Okay, let's start off with our first study, EUROPA trial. This study looked at endocrine therapy versus radiation therapy in early-stage breast cancer. Could you please walk us through the study design and how these results are impacting your practice today?
The Europa trial is an interesting study because this is something we face in our clinic on a day-to-day basis. It's a phase 3 trial of about 926 patients. Patients are older than 70 who underwent a breast conservation surgery with or without sentinel node biopsy, small tumors, T1, N0, ER/PR more than 10%, and with a low Ki67, less than 20%. So they are asking the question of radiation treatment by itself versus endocrine treatment by itself in adjuvant setting. And the primary endpoint is an ipsilateral breast cancer recurrence and quality of life. And of course, they looked at the secondary endpoints, local regional recurrence, breast cancer specific survival rate, etc. So in the interim analysis, what they found was that radiation therapy offers better quality of life than endocrine treatment, and then lower incidence of treatment-related AEs in the RT arm. And at this point, there is no safety signal, there's no safety concern.
As you brought up, this is a common thing that we run into in this particular patient population, but the primary endpoint of looking at ipsilateral recurrence. Often when we're talking about endocrine therapy, we're also talking about decreased risk of contralateral. We're talking about decreased risk of distant disease here as well. Based on this study, Jame, is this going to change your practice, or are you waiting on long-term data?
I think we should wait for long-term data to apply this broadly. But when I talk to this particular patient who has joint pain, and I'm sure she already has tried this, then I can say, if you want to choose one versus the other, RT is fairly safe. And then because of what we just talked about, if you want to omit endocrine treatment, it's not completely unreasonable. But of course, it's a risk-benefit, individualized, shared decision-making.
Absolutely. It was so exciting to see that this SABCS, we saw quite a few studies trying to focus on de-escalation and ensuring that less is perhaps more, and this was one of the studies.